All right, continuing the airway and breathing course, looking at the laryngoscopy unit. This is DL technique, a pretty quick hit at direct laryngoscopy technique. This is best learned in a lab setting where you have a chance to manipulate the equipment and actually play around a little bit, and you'll get a much better feel for this. But there's some background information. So your tool, your direct laryngoscopy blade can either be straight or it can be curved. The curved blades are called Macintosh blades, and the straight blades are either Miller, Wisconsin, or Grandview. Miller seems to be the most common that we find. They also come in different sizes, as you can see, different lengths, and you'll size that blade based on experience and a guess in terms of the size of your patient. The curved blade, usually Macintosh. I've never seen a curved blade that wasn't a Mac, although there are some out there. It's just not common in EMS to see anything but a curved Mac. And not to inflict my own personal style, but that the Mac is much better for me, and I like the Mac 4 as a matter of fact for almost all applications in the adult. But anyway, it's designed to be inserted into the vallecula in order to apply some gentle pressure on that hyoepiglottic ligament, the one we talked about in the epiglotoscopy lesson, and that's going to cause that epiglottis to flip up for you. Straight blades lift the epiglottis directly. They come in Miller, Wisconsin, and Grandview. In the lab setting, we have examples of each of these and get a chance to see it. Basically, it's the height, it's the profile of the blade, and different folks like different things. Miller is pretty common out there, and the Miller blade is to directly lift. Now, this is a key slide. This is one of those things you're going to want to know. This is one of those things that we ask you over and over in quizzes. This is one of those things I should be able to walk up to you in Walmart on a Saturday afternoon and say, tell me the difference between curved blades and straight blades. What's the trade-off? So here it is. The curved blade gives you great tongue control, but you lose a little bit of control of the epiglottis. You're indirectly controlling the epiglottis. You're placing that curved blade in the vallecula and pushing, and that's how you control the epiglottis, indirectly. But you get great tongue control. With straight blades, you sacrifice a lot of that tongue control, but you get absolutely direct control of the epiglottis. So you're like, well, which one should I use? Why do I care? We think that novice airway operators, paramedic student airway operators, will have more trouble with tongues than anything else. And honestly, we have some really good mannequins, some very realistic mannequins. I believe the best that are available. But they don't have real tongues. They have rubber tongues. And so when you actually do get into live patient airways, you do have some tongue control issues, and that's why I think the curved blade is probably your best bet. Now, we will have days in lab where we take away all the curves and make you use straights. We'll have other days where we take away all the straights and make you use curves. So we want you to have some experience at both. And we want you to be able to choose for your patient situation. And you'll find that in pediatric patients, the straight blade is really better anatomically. The landmarks, the locations of things are more anterior and superior in that pediatric patient. The straight blade really works better in the 2 years and younger crowd. But most adults, the curved blade will give you really good tongue control. As long as you can get in the vallecula and control that epiglottis, you'll be fine. So DL technique is a key lesson for us to have some thought about. The operation of that direct laryngoscopy tool, the laryngoscope, it's a battery-powered device. Batteries go dead. So you should make sure you have spare batteries in your kit, and you should make sure that your bulb that is on that laryngoscope is screwed in tightly. They must be tight. And bulbs also wear out, and you can check it at truck checks. You should check it at truck checks. But you know, Murphy's Law says that the bulb won't fail you at truck checks. It'll fail you in actual operation. So we talk about white, tight, and bright for DL bulbs, whether that be on a curved or on a straight blade. DL technique, part of this whole unit that we're working on right now, and we'll move on to video laryngoscopy technique here in just a minute.